Hi, my name is Casius Jr., and today I want to talk to you guys about something super important in all of our lives today. It's affected all of us, kind of put our lives on hold. It was forced upon us, and we're just trying to get through it and beat it. And I think you guys know what I'm going to talk about, and that's coronavirus, and how important it is to wear a face mask in public, what it can do for you and other people around you. About 2 or 3 months ago, you would go out in public and you wouldn't see too many people wearing a face mask or taking the same safety measures that people do today. Today, you go out in public and you see almost everybody wearing a face mask, washing their hands frequently, or social distancing. And I feel like the number one reason for this change is because people are becoming more educated on coronavirus and how serious it can be. This virus is not a joke and anybody can get it. And I feel like the number one way to stop the spread of this virus is to educate people on what it is, how it works, how it spreads. And another thing that's been circulating in the news lately is why America is spiking up in cases and other countries are either staying the same or going down. I'll talk all about this in my speech, but I really just want the audience to fully understand the importance of having a face mask in public, what it can do for you and other people, and how it's all of our jobs to really stop the spread of this virus. What exactly is COVID-19 and how does it affect our health? Johns Hopkins from the globalhealthnow.org talks about this. COVID-19 is a type of virus that has an RNA strand topped with a spiky crown of proteins. The crown-shaped proteins is where the virus gets its name. Corona is crown in Latin. This virus inserts its genetic material into the cell's nucleus by attaching the spiky proteins to the host. This cell will translate its RNA into the new host and it will make copies of the virus. So basically, this cell that's infected with this virus can make copies of itself in a matter of hours. This virus is zoonotic, meaning it can affect humans and animals and be contracted from humans and animals. COVID-19 can affect people in many different ways. Reed Shaposh talks about this from the Salem Press. Symptoms from contracting COVID-19 are usually mild and are similar to getting a common cold. So the symptoms may be having a fever, a dry cough, shortness of breath, or feeling fatigued. Some people may have the virus, but they don't know that they have it, and they can pass it to other people without even knowing because, like I said, they don't know they had it. Elderly people or people with a weakened immune system can experience serious respiratory illness that can potentially prove fatal. So people that are old or people with a weakened immune system, this virus affects them the most or the worst. How does this virus spread and what does wearing a face mask in public do for others? Jamie Catherine, an author, talks about this. This virus is spread by people being in close contact with others or people sneezing or coughing around others, talking or touching others, going to work where you're required to be around other people, going out in public, and being at home without isolating yourself. So if you're feeling the symptoms that I just mentioned earlier and you're at home, you should probably isolate yourself from your family. Just being at home does not mean that you're safe from the virus. Wearing a mask when out in public and following other safety measures can help prevent the spread of this virus, and Mayo Clinic staff talks about this a lot. Wearing any type of face mask will help you from your mouth and your nose from droplets, splashes, and sprays from others containing germs. Wearing a face mask protects others from your germs. Washing your hands and practicing social distancing is key to preventing the spread of this virus. Why are Americans showing more confirmed cases than most other countries with this virus? Leonard Geeds from the Rise of COVID.org talks about this a lot. Most testing is available in America than in other countries. So basically, America does a lot more testing. Well, I wouldn't say a lot, but just more testing than other countries. States with large populations have been pressured to let people go back to work, and these states are showing the highest in cases, and these states are Arizona, Florida, and Texas. It's not required to wear a face mask in public, but a lot of businesses in America are starting to make people wear masks before they come into the store or a restaurant to get, their products or their food. And I'm all for that. I'm not for making it a law that you have to wear a face mask, because if you don't want to wear a face mask, that's on you. But if you want to come into somebody's store where there's a lot of people in there, I feel like you need to wear a face mask, and I'm all for making it legal for that happening. What do the experts that study the virus say about COVID-19 now? COVID-19 will make an upcoming flu season worse, or this upcoming flu season worse, because COVID-19, like I said, it has the same symptoms of having flu. The flu season's coming up, and plus the weather is going to get cold. It's not good. The best way to minimize the chance of getting infected, get a flu shot, wear a face mask, and practice social distancing, washing your hands. All these things can really help prevent the spread of this virus. And Aaron Funk from COVID Discovery talks about all this. So basically, just wearing a face mask doesn't only help you from not getting COVID-19, but it also helps other people, stay safe from, maybe you. Because like I said earlier, you may not even know that you have it. Not a lot of people get tested, but wearing that face mask can just prevent you from spraying any type of germs on anybody, and also protect you from other people. And I feel like it's all of our jobs to really listen to the experts that are saying, wearing a mask is, helpful, and, take their word for it, because we're not the ones studying this virus every day. They are, and they're the ones telling us we need to do it. So I feel like it's all of our jobs to really pay attention, be educated on coronavirus, ask questions, and really just take the safety measures that the professionals are saying that we need to do to stop the spread of this virus. Thank you.